Good evening, Bahamas. I'm Altavis Mannix, and welcome to the ZNS News Live Report. Tonight, we're going to give you an update from Ministry of Health officials on Ebola. If you have been watching the international news, you've noticed that 3 cases of Ebola have emerged in the U.S. 1 victim died while 2 remain in the hospital. The cases of Ebola are dominated in West Africa, and health officials around the world are using every precaution possible in order to prevent the deadly disease from reaching their country. Tonight we have the Chief Medical Officer, Dr. Glenn Benaby, who will first read a statement from the Ministry of Health, and then we will hear from Dr. Benaby as well as his colleagues, Mary Lightbourne Walker, who's the administrator for the Princess Margaret Hospital, as well as Charlene Bain. She's the Community Services Administrator for the Department of Public Health. Dr. Benaby?
Thank you, Madam Mannix, and good evening, Bahamas. The Ministry of Health is acutely aware of the situation regarding the Ebola virus disease globally, and would like to take this opportunity to again address and update the Bahamian people regarding the topic. The current Ebola outbreak in West and Central Africa started in December of 2013, with the World Health Organization being made aware of the gravity of the situation in March of 2014. A total of 8,470 confirmed, probable, and suspected cases of Ebola virus disease have been reported in 8 affected countries: Guinea, Liberia, Nigeria, Senegal, Sierra Leone, Democratic Republic of Congo, Spain, and the United States of America, up to the 10th of October. There have been 4,076 deaths. On the 30th of September 2014, the Pan-American Health Organization and the World Health Organization was informed of the first confirmed imported case of Ebola disease. The patient passed away in the United States on the 8th of October, and on the 6th of October, the World Health Organization was informed of the first confirmed case of human-to-human transmission of Ebola in Spain, after a healthcare worker tested positive for the Ebola after treating a patient who had been repatriated from West Africa. This case represented the first human-to-human transmission of Ebola outside of Africa. Most recently, we have been informed of a second case of human-to-human transmission of Ebola, this time in the United States, in a healthcare worker caring for the imported case of the Ebola virus. Again, this course of events have been of particular interest to the Bahamas because of the volume of travelers to our islands and the travel of our residents throughout the globe and returning to our shores. The Ministry of Health began spearheading the nation's preparation and response to Ebola months prior to its introduction to our hemisphere. Stakeholder groups were gathered to assess the readiness of the health sector, both in the public and private sectors, for encounter with Ebola. After assessment, definitive plans and actions for improving the system readiness were enacted, including procurement of personal protective equipment, defining reporting structures and mechanisms, establishing linkages with international organizations and testing facilities, training of personnel in relevant recognition and treatment protocols, among other actions. During the preparation of the health sector, engagement was initiated with our non-health sector stakeholders, to include our armed forces, border control officers, ports of entry entities, national emergency planning agencies, the media, and many others. These discussions and planning activities resulted in the drafting of a national Ebola response plan as a focus exercise between the Ministry of Health and the Pan-American Health Organization. The foundation of the plan included the national response plans for cholera, pandemic influenza, and severe acute respiratory syndrome, better known as SARS, but taking into account the unique features of Ebola. The Bahamian public should know that as the Ebola situation continues to evolve, so will our plans, as both are dynamic. There's an exercise involving the suspected case of Ebola in country in mid-September presented us with an opportunity to test our preparation. Although areas in need of strengthening were identified and are being addressed, we have been in constant communication and with our partners in the region and have received commendation by our Caribbean, regional, and global partners for our handling of the situation. We will not leave any stone unturned, as we know that complacency will threaten our national security and potentially our way of life. We will remain vigilant in ensuring that the population health is protected from this and all threats with the most appropriate response we can provide. We look forward to engaging with all partners throughout the public and private sectors in order to ensure this global threat is contained and ends. And now a few points about Ebola virus disease itself. Ebola virus disease is a severe disease characterized by sudden onset of fever, intense weakness, muscle pain, headache, and sore throat. These symptoms may be followed by vomiting, diarrhea, a rash, impaired kidney and liver function, and in some cases, both internal and external bleeding. The World Health Organization has recommended persons avoid unnecessary travel to Ebola-affected countries at this time. Persons who do travel to affected areas should ensure that necessary precautions are taken to avoid exposure, especially avoiding the bodily fluids of symptomatic patients. Travelers who experience any of the above mentioned symptoms within 21 days of arriving in the Bahamas should consult their healthcare provider immediately or contact the surveillance unit at the Department of Public Health at the following numbers: 502-4776 or 502-4790 or 397-1021. We, as a part of this healthcare team, is doing all in our power to address this significant global issue. We realize the importance of it, and in this vein, today, in addition to all that we are doing, a task force has been established in the office of the Prime Minister. This task force consists of all of the agencies, relevant agencies of government, and we shall be doing all in our power on an ongoing basis to be updated from the global healthcare community, to speak with our partners in the region, and to address this serious issue head on. We are depending on the Bahamian people to take full control of their situation, to not panic, to remain calm, and to communicate with each other in communities and throughout the Bahamas. We realize the importance of this to our country and to tourism, and indeed, more importantly, to the safety of the public. Thank you very much, and we look forward to working with all of our partners.
And that was the official statement from the Ministry of Health, particularly the Chief Medical Officer, Dr. Glenn Bimini, on the fight against Ebola here in the Bahamas. As I mentioned earlier, this is the ZNS News Live special report. And now, Dr. Bimini, I'm going to ask you some questions from the statement that you just released to the Bahamas. You talked about the partnership between non-government and government agencies in the fight against Ebola, but tell us exactly, explain to us exactly what does the procedure entail in the event of an Ebola case does surface here? What exactly will take place immediately when health officials find out that an Ebola case has been discovered here in the Bahamas?
The most important thing, and even before a case is discovered, when you suspect that a person who may have traveled within the last 21 days from any of the areas which I mentioned earlier, or the person may have any of the symptoms, and you suspect that patient should then be isolated, quarantined in an isolated area, and managed as such by the healthcare workers until such time as a definitive diagnosis is made. And that should be the first step.
Some of our Caribbean counterparts, I understand, have already closed some of their ports from any potential Ebola case here. From the meeting that you've had with law enforcement agencies, is the Bahamas preparing to do the same?
We have all preparation made to take what actions are necessary. At the moment, we have not decided to close ports. What we have decided to do is increase the awareness of our workers at ports, to have protocols specific to what should happen at our ports. If in our determination it becomes necessary to make that major step, it will be made. But at this present moment, we have not decided to do that. But let me say quickly before I go on. We are in meetings on a regular basis. We are being updated on a regular basis. The plan now is to speak to this issue on a daily basis until such time that we are satisfied we are on top of the situation.
That means then we and the media can see press conferences, or we can gain access to interviews from any health official when needed.
Appropriately, that will be available to you.
We'll hold you to that. Thank you so much, Dr. Bimini. Not that I'm going to stop asking you questions, but now I want to go to Madam Administrator, the PMH. If we do get that suspected case of Ebola, Ms. Lightborn Walker, do we have the facilities to quarantine a suspect? Are we adequately equipped to quarantine someone with Ebola in the event that they do arrive here?
Yes, we do have an identified location, not only in the public sector, but also within the Princess Margaret Hospital. And we, as Dr. Bimini would have alluded to, are in possession of the protective equipment that is necessary. In addition to that, we have been training staff, and that training is ongoing. We want persons to be as comfortable as possible, and a part of the training is that they actually get to put the equipment on and take it off, and to realize this is the procedure, how to put it on. We call it donning, and then removal. And it's important that you do it in the right sequence. And so healthcare workers, this is something that we do, and it's something that's called contact precautions. And we're taking it to the nth degree, and that's what it's all about, to stay safe.
Are we following regional Bahamas or CDC guidelines when it comes to
World Health and CDC guidelines? We are following that. In fact, the CDC would have put out a script from the beginning of all of this, and so the message is a standardized message so that there is no ambiguity. We know exactly what we're saying. If it is indeed 2 or 3 people given the message, it is a message with many voices, but one script, one message.
The staff at the PMH then are very ready to handle any Ebola case, right now?
Yes, we have that contingency in place, and they are ready. There is a cadre of staff that are ready and prepared.
Madam Community Health Services Administrator Charlene Bain, thanks for joining us as well. I want to now go to prescription drugs, if you're able to talk about any drugs in the event an Ebola case comes here. Do we have enough medicine to accommodate any cases, or even if it's just one case of a suspect with Ebola?
Well, the treatment of Ebola is not based on medication, but is supportive care, and that is intravenous fluids. And yes, we have the appropriate intravenous fluids to treat any of the case or any suspected case that would come to our shores. We also have what we call oral rehydration salts for persons who, in the event you might not be able to get up an intravenous line, that you can give them other means of rehydration therapy. And so when it comes to the supportive care for persons, we have all of the necessary intravenous fluids on hand.
If someone comes here with Ebola and they die eventually, can you explain to us how that body will be disposed?
Well, we will always be in contact with the infectious disease specialists. We will be in contact with morticians. We have provided body bags, and we will follow the safety protocols. The hospital has had the experience of dealing with this, and so we're in collaboration with each other, and there is a specific guidelines to guide how we address that matter.
You want to add more to that, Ms. Walker?
The ultimate disposal is cremation, yes. That is the recommended guideline internationally.
Have you found, Ms. Walker, that Bahamians who watch the international media are expressing concern to your staff about Ebola coming here?
Yes, they are. There's a lot of information out there, and they want to feel and to be able to say that they are equally informed. And in fact, we have been encouraging staff that if persons do ask them, and they have the knowledge base, that yes, try to make persons feel just as comfortable with this matter as you are.
Dr. Barnaby, can you explain to us the difference between Ebola and malaria?
Well, they're both conditions that involve the blood. In the case of Ebola, Ebola is a virus condition, and once you get Ebola, it multiplies within the blood system, and it is that multiplication that results in the symptoms that you eventually see. Perhaps the main difference is that Ebola, being a virus, is different from malaria, which is a parasite. And there's a defined treatment for malaria. As opposed with Ebola, there is no defined medication treatment. And so the outcome is a high mortality, and this put healthcare workers at great risk, as opposed to malaria, where there's defined treatment for these cases, and most of the patients, if they're caught early enough, can be treated and cured, and indeed you can take prophylactic treatment in the case of malaria. But the great concern with the Ebola is the difference that you face because of the challenge of transmission. In terms of malaria has a vector. Ebola is different. You get it from contamination from the blood or serous fluid actually entering through some break in the external skin.
And then the difference between Ebola and HIV/AIDS?
Oh, they are not similar at all. I think we ought not to get them mixed up, you know. But I can understand why people will do so.
You mentioned a task force that's been implemented in the Prime Minister's office. Exactly what would they? You also mentioned that they will be meeting on a regular basis, but what will they be discussing, and how will the public understand their role as soon as they begin meeting?
You must understand, as of course most of us do, that we are an archipelago of extending more than 100,000 miles with numerous ports, and almost a situation where we have to provide health care through all these major islands. And so the task force has on it representation from Ministry of Tourism, from National Security, from Environment. It has on it Port Health. It has on it all of those agencies that will be affected or have some role to play. Transport, and there are many. And although it is important to appreciate that it's a vast area you're covering, you must have a consistent, standardized approach that is well communicated and well linked. And fortunately for us, as a developing country, we have received commendation at the world level for the way we manage our suspected case of Ebola at the 53rd Directing Council meeting, which was held at the end of September in Washington, D.C. Our Minister of Health made a particular presentation, and all of the experts were very pleased that we had managed the case extremely well.
Getting back to the ports, as you mentioned, we are an archipelagic nation. And I wanted to know, any of you can answer the question, do we have a Ebola team in Anagua where some Haitians may come, Abaco, Eleuthera, everything may not come through here in New Providence? Is every island ready for any case of Ebola that may surface in the Bahamas?
The answer is straightforward, yes, but the readiness is different in some of the islands because of the nature. But there is preparation being made in each island. But I would allow the administrator from the Department of Public Health to respond to that particular question.
To answer your question, yes. What the public might not be aware of is that we have 56 what we call Sentinel sites on a daily basis that is reporting surveillance matter or matters of public health interest. So when it comes to Ebola, we just enhance what we all have been already doing in the Bahamas. But yes, we have targeted every major family island. In fact, our team is presently in San Salvador. We've completed Rumkey and San Salvador. We're moving to the Eleuthera on Sunday, and we will be in Andros, Mangrove Key, and Kemps Bay. We're moving into Bimini. Every island will be reached, and every island will have a stockpile of supplies in the event that something was to show up at their door.
And all of these individuals have hazmat clothing or the necessary clothing to protect themselves as well as protect the suspect from Ebola?
Not all of them will have, but by Wednesday this week, every major family island and every main clinic will have the protective personal equipment.
I want to get back to the concern of Bahamians, Ms. Walker. What were some of the Bahamians who were calling the hospital expressing? What type of concern were they expressing about this deadly virus?
They wanted to get an assurance, really, that we had a plan in place, because they would have heard numerous stories that there is no plan. But yes, there is a plan, and we've been assuring them of that. And that's been basically the thrust of their concern. And they've also been listening to the media, and they realize that we are a tourist destination, and that is a possibility that it can happen. We can have a case coming here. And so it's a natural thing for persons to feel as if they need to be aware and to have the assurance that the government is prepared, and we in the healthcare sector take it very seriously. And yes, we're prepared.
Dr. Benepi, are you satisfied that Bahamians right now understand how to protect themselves in the event a case of Ebola arrives here?
There is room for improvement. The fact of the matter of the awareness, although in some cases may be negative, but it has placed us in a positive position that people are now beginning to pay attention. And now that they are paying attention, we have the materials available to share. We have the cards at Public Health that express and delineate the symptoms that you look for, and we'll be distributing these cards. We have pamphlets that we'll be distributing. And over the next few days, there will be specific advertisements in the media with your help, and we are grateful to you and to the ZNS Corporation for allowing us this opportunity. And we look forward to all of our players being involved. Let me say quickly, because they're not represented here, and I think I ought to say this, the private sector has been very much involved, Doctors Hospital and the other clinics, in supporting. They're being present at the committee meetings, and they are aware of what is going on, and they are prepared as much as they can be to address the situation. I conclude by saying this is not a simple matter. This is a serious matter. We respect it as such. We have done all in our power to be prepared, and we will continue to do so. And we look forward to all responsible Bahamians to cooperate with us and to be aware and to contact us if there's any concerns that they may have.
Now, Dr. Barnaby, Ms. Walker, Ms. Bain, there may be a member of the public who is listening to us tonight, taking all the precautions, listening to the information being disseminated, but what if they're interested in learning how to protect themselves from Ebola before a health official gets to them, or if they want to know how they can protect their family from any Ebola case or whenever Ebola arrives here? Is that something that you would advise?
I would ask them to continue to pay close attention to the media. We have prepared and in the process of preparing demonstrations that will be aired on television that will clearly show them what are the safe measures they can use that are available to them to protect themselves. These advertisement or public service announcements will be clearly laid out and demonstrate in a practical way, practical things, not only the international standard things that can be done, but other practical things that may be necessary in situations in our rural setting.
And you're confident, sir, that if an American comes here, say from Dallas, Texas, where Ebola is dominating in the U.S., are you concerned or are you satisfied that there will be no slip up here in the Bahamas that we would not know that a citizen from Dallas, Texas has not encountered a person with Ebola or has been in an environment with a person with Ebola?
I am confident that if they adhere to our protocols and if they do what they ought to do, the chances of us having a challenge would be mitigated and minimized. But it does not mean that we must rest or we must not be constantly aware. This is calling for us to have proper surveillance, be diligent, and prepared to intervene whenever there's any need to do so.
What advice would any of you give to parents who want to ensure their children that they are protected from Ebola?
I would just like to say to the Bahamian people that we have one of the strongest disease surveillance system and mechanism in the world. And that's why we've been so successful. And for the parents to know that we have access to information through the 90 primary healthcare clinics that is in, I should say the 98 primary healthcare clinics that is in the Bahamas. They can always go to one of our health clinics for information as to how to protect themselves or to get additional information as to what is Ebola and how to recognize if somebody who has traveled outside of the country within their families comes back home and how to reach us. We are on call 24 hours a day, 7 days a week. There is a port health officer who is on call. We have an emergency mechanism that a nurse is on call, and physicians are on call 24 hours a day. So there is no limit to how we can be accessed. And just come into any of our healthcare facilities. We will be starting, like Dr. Barnaby said, messages for the communities, and we have a strong partnership with the general public in New Providence as well as the Family Islands. And so we are confident that together our partners, our clients, and our people will work with us.
Final question, when will the public be able to participate in any of the Ebola seminars or presentations the Ministry of Health will launch?
We have prepared what I will call the documents, and we will be alerting the public of the specific dates when they can attend the public seminars. But remember, I said earlier, going forward on a daily basis, we will be updating the media and updating the public through the media. So these dates will be as is necessary, articulated and shared with them. And so we are confident that if we continue our communication the way we ought and the way the public will continue to cooperate with us, we are likely to maintain the safe public health environment and indeed the safe healthcare environment in the Commonwealth of the Bahamas.
And there are no cases of Ebola here in the Bahamas right now?
There are absolutely no cases of Ebola in the Bahamas that we are aware of, and we pray God that we keep it that way.
Thank you very much, Dr. Glenn Benaby, Chief Medical Officer, Ms. Mary Lightbourne-Walker, Administrator of the Public Hospitals Authority, and Charlene Bain, Community Health Services Administrator for the Department of Public Health. Thank you so much for joining us on this ZNS News Live report. Thank you to Bahamas for listening, and we hope you got all the information you need on Ebola. We will continue to follow all Ministry of Health presentations, information, press releases on any case of suspected Ebola that may come here. We encourage you to stay tuned to the ZNS network for every piece of information that will be disseminated by the Ministry of Health on the fight against Ebola. I'm Altaviz Manning. Thanks again for watching. Have a great evening.
Good evening.
Good evening.